Welcome to The Explainer. Today, we are diving into a development that is, frankly, a huge deal. It could completely change how we screen for prostate cancer, and that's something that affects millions of men all over the world. All right, let's kick things off with just one number. But this one number, it pretty much tells the whole story. 75%. So what is that 75%? Well, get this. It's the estimated number of men, that's 3 out of every 4, who go through a pretty stressful, not to mention invasive biopsy, only to be told, nope, no cancer here. That's a massive problem, creating so much anxiety and leading to medical procedures that just weren't needed in the first place. So you have to ask, how did we even get here? Well, for decades, the go-to has been a blood test called the PSA test. But as you're about to see, it's kind of like a flawed check engine light for your body. And as urologist Dr. Garrett Pullman puts it, the PSA test is a pretty good first alert. It tells you something might be up, but its biggest problem is that it just isn't very specific. Okay, so what the test does is measure a protein called prostate-specific antigen. But here's the catch. A high level doesn't automatically mean you have cancer. It could just be a simple infection or a harmless enlargement of the prostate, which, you guessed it, leads to a huge number of false alarms. Here's a great way to think about it. Imagine the PSA test is like picking up a book and putting it on a scale. It can tell you, hey, this book is heavier than it should be, but it has no way of actually opening the cover and reading what's inside to find out why it's heavy. So how do we fix this? Well, to get to the solution, we've got to dive into some really cool science. It's a field called epigenetics, and it's like we've just discovered this hidden layer of software that's been running on your DNA all along. Right, so if you picture your DNA as a computer's hardware, that fixed blueprint you're born with, then epigenetics is the software. It's this dynamic, constantly changing layer of instructions that tells your genes which ones to turn on and which ones to turn off. And it gets updated by everything from your lifestyle to your environment. And that ability, the ability to read our body's own software, that's what's powering this incredible new test. It's called the EpiSwitch Prostate-Specific Epigenetic Test, or just PSE for short. Okay, let's go back to our book analogy for a second. Remember how the old PSA test could only weigh the book? Well, this new PSA test, it's like it can actually read the little sticky notes and highlights that cancer leaves behind on the pages. And how does it do that? It's looking for 5 really specific epigenetic biomarkers that are just floating around in your blood. You can just think of them as the fingerprints of cancer. They show these unique patterns in how your DNA is folded that are a dead giveaway for the disease. Okay, that's the science. But what does this actually mean for you, for a patient? Let's do a quick head-to-head comparison of the old way versus the new way. The result of this whole new approach, really, it all boils down to one absolutely critical number, 94%. Yeah, 94%. That is the jaw-dropping accuracy of this new PSE test. See, by combining that old PSA number with these 5 new epigenetic markers, it can predict whether you have prostate cancer with just incredible precision. I mean, just look at the difference here. It's night and day. We're going from a single, often confusing number that needs a ton of interpretation to a super clear, actionable result. It's basically a simple high or low likelihood. We're literally moving from guesswork to near certainty. So what's the bottom line here? What does all this fancy science really change in the real world for patients and their doctors who have to make these tough calls? The impact is huge. For patients, we're talking about far fewer invasive, stressful biopsies and a massive reduction in anxiety for them and their families. And for doctors, it gives them so much more clarity to make the best decisions. It's a clearer, more confident path forward for everyone. And this isn't just theory. When you actually run the numbers, the models show this PSE test could help us avoid almost 80% of all those unnecessary biopsies we talked about right at the beginning. This could totally reshape the entire diagnostic process from the ground up. So when you step back and look at it, this shift from a kind of blunt instrument to a super precise tool, it's way more than just an improvement. It makes you wonder, right? By finally learning to read the software of our own bodies, are we looking at the future of how we detect all cancers?